family mode.
Okay. Sí. Okay.
Hello, everyone. My name is Luz Rodriguez. I'm a social protection specialist at the World Bank. And together with Veronika Wodsak, I have the honor to coordinate ISPA, the Interagency Social Protection Initiative. This is our 5th webinar with the support of socialprotection.org and the first of a series of webinars about the ISPA Core Diagnostic Instrument, or CODI tool. As a reminder, we want to give you the heads up that Veronika will introduce today the tool. And next Thursday, July 13, we will have another webinar about the actual application of CODI in Belize. We want to encourage you to participate in the coming webinar as well. And in September, we will also offer a couple of webinars in French. So please share this information with your colleagues and your friends working in Francophone countries. We also want to remind you that the CODI tool is available in ISPA tools in our website, and we invite you to download it, and because it is accessible in different languages. Our presenter today is Veronika Wodsak from ILO. She's a social security expert at ILO. Veronika has worked in ILO since 2007 in various functions, including health policy officer, social protection floor officer, and social security expert. Veronika is part of the team that support the development of the social protection floor in ILO, recommendation R202. Currently, she's leading in ILO the ISPA initiative jointly with our team in the World Bank. She participated in all the different groups that have developed the different tools, including CODI, and she's leading the development of a new tool called SPOT, the Social Protection Policy Options Tool. Veronika holds a BA in International Relations from the University of Kent in the UK, and a Master's in International Relations from the Queen's University in Canada. In addition of working in ILO, also Veronika has worked as a researcher on the global social policy at the Bielefeld University in Germany, excuse my pronunciation, as well as a research assistant at the World Bank. Before starting this webinar, I would like to invite you to connect via Twitter using hashtag ISPA_CODI, hashtag ISPA_CODI. So let's start the webinar and welcome everyone.
Yes, welcome also from my side. I think we can immediately skip to the next slide and look at today's agenda, what we want to go through, which is a lot. So first I'll give a very brief introduction about ISPA in general. It's always related and relevant also for the core diagnostic instrument. Before I then go into more detail about what the core diagnostic instrument is and the framework of analysis that it presents, 18 key areas across 3 modules. And in the next step, how this framework is used for an analysis of the social protection system performance, and the 10 assessment criteria that have been agreed for this. And finally, I hope we'll have still a lot of time for your questions and answers if there are any. Next slide, please. So first of all, a few general words on ISPA. The interagency social protection assessments, they are tools that are developed to address challenges governments face regarding their social protection systems, regarding the design, but also the implementation of social protection. Sometimes there's a little bit of a confusion about what tools are. Some people seem to think it's software tools. It's not software tools. It's a framework of analysis, really. It's an evaluation tool, if you want. It's not a hammer or a screwdriver either. And hopefully by the end of this seminar, it will be very clear to you at least what the CODI tool is. Next slide, please. So what are challenges that governments face? First of all, a lot of social protection systems at national level are highly fragmented. And that leads to inefficiencies because of duplications between programs, but also duplications in administrative structures, which is not just a problem for efficiency considerations, scarce resources are being wasted, but it's also a problem because it makes it more difficult for potential beneficiaries to access benefits that they are entitled to, because they have to register multiple times, they have more difficulties to access benefits at different service delivery points, etc. Next slide, please. At program level, there are often design flaws that lead to an inadequate addressing of the social protection needs of the population, as well as also inefficiencies and ineffectiveness, and not reaching the objectives that the programs are set up to. Next slide, please. A final challenge that ISPA tools aim to address is the lack of coordination. And this is true both for coordination between national institutions and agencies, but also regarding international actors or donors present at country level. And also the interaction between the national institutions and the donor activities. So coordination can be improved at all these three levels. Next slide, please. So in order to address these challenges, countries seek guidance from development partners to assess their social protection systems, also to design or reform their systems, and sometimes with very specific demands on strengthening certain aspects of the administration or delivery of systems, such as identification systems, the payment delivery mechanism, or other questions regarding the governance and administration of social protection schemes, programs, or the entire system, and also regarding monitoring and evaluation. And in response to this demand from governments to donors to support them with this, ISPA is designed to give an interagency response to these requests. Next slide, please. And with that, ISPA tools have the objective at the system level to help countries and governments to improve their social protection systems by providing a coherent framework for sound analysis. So it's really it's analytical tools, but of course analytical tools that aim for policy relevance, so that countries can improve either their systems at the system level or programs or delivery mechanisms. And secondly, helping to identify policy options to improve the design and delivery of social protection programs. Next slide, please. So what does an ISPA tool look like, or what does it include? Normally there are 4 key elements that are similar for all the tools that we have. One is a guidance note, we call it What Matters guidance, that gives first of all an introduction to the topic that is being addressed, so that it's the conceptual framework, but it also outlines and defines the assessment criteria and explains the logic of the data collection that is needed to carry out the assessment. The second part of the tool is the questionnaire. That is really the key element, if you want, because this is then used for the data collection. And the third one uses the conceptual framework and the data collected through the questionnaire and combines this into an assessment matrix to give an overview or summary of the findings. And finally, the country report that is drafted that will discuss findings in detail. It will present the assessment matrix overview, but it will also provide a narrative, always guided by the assessment criteria and the data collected through the questionnaire. And finally, we have a set of generic implementation guidelines that are the same across all the tools that explain how to use these 4 elements and lay down some principles for how to conduct ISPA assessments. And the most important thing there is that a key principle is participation and country ownership, so that ISPA tools should be applied by governments themselves or upon request from governments. And all relevant stakeholders should be involved in carrying out the assessment. Next slide, please. So eventually we hope to develop tools that really address each and every aspect of a social protection system. Currently there are 4 tools available, the core diagnostic instrument that we're going to discuss today. At the program level, we have currently a tool developed on social protection public works programs. Very soon there will also be a tool available on food security and nutrition. And further down the line, we hope to develop tools on cash transfers, on pensions, and on health. At the delivery systems or implementation mechanisms level, we already have available on the website a tool looking into how to deliver social protection payments and on identification systems for social protection programs. And we hope to, just to give you a flavor of what other tools fall into the delivery systems category, there would, for example, management information systems, complaint and appeals mechanisms, etc. Also, and this is quite new, we will have available the tools translated into Arabic, French and Spanish to facilitate their use across different regions. Next slide, please. So now coming to today's topic of the core diagnostic instrument, what is it? And looking a little bit also into the operationalization, but as Luz already mentioned, we'll have a full webinar dedicated to how the tool can be applied using the example of Belize later. So we'll focus now more on the conceptual framework of CODI. Next slide, please. So the framework that CODI provides allows to carry out the following step. First of all, a stock taking of everything that is relevant for the social protection system. Most important, of course, this is a mapping of the existing schemes and programs, but it also includes a stock taking of related social protection policies or legislation, and any other information that is relevant for the social protection system. After this mapping, the tool allows an analysis of the social protection system performance, both against national objectives, but also, and in the context of this tool more importantly, against the standardized set of agreed CODI criteria. And these criteria, I mean, we didn't just make them up ourselves. This is really what social protection experts in all the relevant agencies, as well as national stakeholders where we applied the tool, thought that this is the key aspects to focus on when assessing social protection systems. And thirdly, on the basis of the mapping and the assessment against the national objectives and criteria, the tool aims to identify a set of entry-level policy reform options or recommendations on how identified challenges can be addressed. And throughout this process, as I already mentioned, the tool is based on certain principles that aim at the promotion of dialogue, exchange, and coordination between national and international partners. Next slide, please. So the next thing I want to do is to introduce a little bit of an interactive element in this webinar. I hope that all of you have already discovered the chat function that this webinar software allows you to use. For those of you who don't see it right now, on the top right you should see a little microphone, a little orange arrow, I guess, that you can use to expand a panel, and then there is a chat function. And I would like to invite you in the chat to now post items that you think would be important when carrying out a social protection system assessment. So if you were tasked today to carry out an evaluation of the performance of your country's social protection system, where would you start? What would be your priority areas to look into? If you now use the chat function to post the areas that are important to address when assessing social protection systems, then Luz, as our moderator, can pick that up and share with us the items that you've been posting. Don't worry, this is completely anonymous. Nobody will find out who posted what, so you can't embarrass yourself. You can just feel free to brainstorm and write whatever you think is important. So I'll give you 2 or 3 minutes to think about it, and hopefully you discover the chat function and post this. And Luz, maybe you can, if suggestions come in, you can start sharing what people think is important to look at for social protection assessments. Oh, don't switch to the next slide, otherwise you'll spoil it and everybody can see what we're looking for. Thanks. Is anything coming in, Luz?
Not yet.
Not yet. Okay, we'll wait for another minute. If nothing comes in, then we can just continue. I can warn you, I'll ask the same question for the criteria. So if you can't think of any key areas to look at now, already start thinking about criteria to use for assessing the system, then we can try that again.
Socialprotection.org. It has some comments. Questions bar. Okay. We have one suggestion: youth employment rates.
Youth employment rates, okay.
Existing programs, social protection areas and coverage. Type of programs being implemented, registration systems. ID system and MIS. Laws or guidelines. Delivery systems, coverage, adherence to some sort of payment calendar for the delivery of to the beneficiaries, payment systems, targeting systems. Yeah, those are the ones that we have so far.
Okay, great. Thanks a lot for participating, and thanks for your great inputs. They are all included in the CODI tool, and they are all relevant. So now we can switch to the next slide and take a look at them. So basically, we've organized these key areas into 3 levels. One is the policy and legal, or into 3 modules. One is the module on policy and legal framework, one is a module on program design, and one is a module on program implementation. And your inputs speak to all 3 of these different modules. Somebody even mentioned laws, so this is the first key area that is included in CODI. So there are, it is important for a social protection system analysis or assessment to look into the existing legal and policy framework. What does the law say is the government obliged to provide in terms of social protection for the population? At the same time, at the policy level, it's also important to look into the existing needs of the population. So you need basic data regarding poverty, regarding unemployment. Somebody mentioned more particularly youth unemployment. So anything that can help to find out more and know more about the socio-demographic profile of the population, the better you can design your social protection programs to speak to the needs of the population. Then, in order to turn the social protection aspirations or objectives that you have into policy, you need to understand how the policy-making process works and how social protection policies can go through this policy-making process. And then once the policies are formulated and adopted, how they are then implemented at the different administrative levels, down to the community level and ultimately the household level, and the institutional capacities that exist at each administrative level, so that if you want to make suggestions for policy reforms, how to improve the social protection policies, you can actually speak to make reform proposals that actually are in line with what the country can manage institutionally. Then also at the policy or level or the national level, there's the central level public expenditure and financing. You need to be aware of what the government budget looks like, and possibly how the fiscal space can be expanded. So at a very aggregate level, it's important to analyze social protection expenditure currently and trends, looking into what has been spent in the past and what are projected expenditures, and as I said, possibly also how more fiscal space can be freed to contribute to implementing the recommended reforms. The next is on information and awareness. Obviously, it's important that the population is well informed about existing laws and policies related to social protection, and also how that the population is informed about how to participate in the policy-making process. And then you also, in order to assess the social protection system, it's also important to look into what monitoring and evaluation frameworks at the central level exist already. A lot of countries already make a lot of efforts to themselves analyze a little bit the performance of their social protection systems, and it's important to capture that information also when implementing CODI. At the program level, and this is also, a lot of this has been mentioned from your inputs, it's important to look at, in terms of design, what eligibility criteria are set out for beneficiaries. Then the benefit design, and here, I mean, the concrete benefit design as in, is it in kind, is it a cash benefit, what is the periodicity of how it's being distributed, etc., etc., how beneficiaries can access it, and so on. And then at program level also, it's important to analyze financing and expenditures. Is the program sustainable, and are the resources committed sufficient to meet the objectives of the program? And then also in terms of, and this is a very important aspect of the program design that can make a lot of difference in terms of the outcomes and unintended consequences it produces. What incentives does a program give rise to? In the program implementation module, it's really about the implementation on the ground. So how are beneficiaries identified? And again, I mean, you've mentioned this in your inputs. How is eligibility verified? How do beneficiaries enroll? First of all, to become members of a scheme, but then secondly also to claim their benefits. How is the benefit then delivered? Also at program level, of course, monitoring evaluation is important. And then finally, this is important for potential beneficiaries to actually realize their entitlements. What are the complaint and appeals procedures for a program? Next slide, please. So the next, this is an example of what a part of the questionnaire looks like. The questionnaire is organized by these key areas, so that for, I mean, because the key area group, they group a certain theme, right? Financing or policy framework. So the questionnaire gathers the information according to these key areas. And so you can see here, this is the first key area that I mentioned, national, legal and policy frameworks. And in the questionnaire there's a column to give the actual response, but the questionnaire also indicates a potential source of information. So where can you potentially find this information? The source is quite generic. It says, I mean, potentially, for example, for the laws and policy frameworks, these can be found at either the ministry's website or by contacting a ministry's official. And then at the last column, you can see the assessment criteria that this question is relevant for. So here you can see the typical kind of questions that are included in the questionnaire and how the data is collected. A lot of the data is actually not quantitative, it's qualitative. A lot of it is really about the processes and really the specific arrangements that are currently in place. So this cannot be a simple yes/no question, but actually you need to put in some text. At the same time, we'll see later in I've got a couple of slides with examples of the questionnaire. Other responses are more multiple choice or yes/no questions. So and you can see that actually the instrument tries to look into the details because it's a systems assessment. It looks into all the different contingencies and all the different target groups. So the task can seem a little bit overwhelming, but by breaking it down into different key areas, the work can easily be split and be distributed across the different institutions responsible for each aspect, or different researchers working on this, and that makes it manageable. So, for example, also for the laws, we ask for the laws by function. So we ask for, is there any specific legislation that addresses the different social protection contingencies, including child or family benefits, unemployment, maternity, sickness, disability, etc. Can we go through to the next slide, please? I mean, this is just some more information about questions. I think we can go through straight to the next slide. So this was an example of the first module on the policy module. The next example on the next slide is on the program design module. So it talks about, can we go through to the next slide, please? It says this is the key area 8A, and this is about the eligibility criteria. As we saw before, eligibility criteria is a key aspect of program design. Who is eligible to benefit from that program? And so possible eligibility criteria are listed here as a multiple choice yes/no answer. For example, is it poverty targeted? Do you need to is it limited to a certain age group? Is it limited to a certain education attainment? For example, is it only for people without a school degree? Is it targeted at unemployed, etc.? So that this is on the eligibility criteria. Can we go through to the next slide, please? The next slide continues questions around the eligibility criteria. For example, are there disqualifiers for a program? A lot of programs, you can't benefit from them if you already benefit from another program, things like that. Can we go through to the next slide, please? So the last example is from the third module on program delivery. So this is the key area 15 out of the 18. And again, you can see there is really a lot of detailed questions being asked on how benefits are delivered. And here it's contingent. I mean, it asks for cash benefits. How are they delivered? Is it electronic? Is it in cash? For in-kind benefits, how is it delivered? And also, how is the delivery verified? Is this electronic or is there manual record keeping, etc.? Can we go to the next slide, please? Okay, so having introduced you to the kind of logic of the different key areas and what the data collection instrument, the questionnaire, looks like, we now pass on to the analysis of the performance using the CODI assessment criteria. And again, I would like to invite you to type into the chat function the criteria that you think are important when analyzing social protection systems. So take a few minutes and enter what you think are criteria or indicators that would be important to trace when assessing social protection system performance.
Non, et puis en fait, l'autre jour quand on en a discuté rapidement, moi ça me va, hein. De toute façon ça va être assez générique afin de pouvoir mettre ce qu'on veut dedans. Et puis sinon je me disais que peut-être qu'il faudrait...
Luz, did anybody start putting some inputs that you could share?
Sure. We have some here. Coverage, 1. Timeliness of payments, if the payments are delivered on time. We have another participant, adequacy, coverage, sustainability, cost effectiveness, and targeting, how targeting is carried out and how the program is being delivered, and how coherent the social protection system is. What resources the social protection system has. What's the institutional capacity? That's basically what we have so far.
Okay, great. I think
social inclusion as well.
Wow, I think almost all of them are there. Excellent. It means that maybe CODI is more intuitive than I think. So can we move to the next slide, please? The next one gives an overview of the 10 criteria that we have. We will discuss each of them in detail, but coverage that was mentioned already several times, you can see this is also the first one that we put, because obviously, arguably the two most important criteria for the performance of a social protection system is who is covered and the level of benefits that they get. So adequacy, what benefits do the people that are covered receive. then the appropriateness means the benefits that are being provided appropriate in light of, first of all, the needs, but also the capacity of the country. Then we have respect for rights and dignity. Maybe we can spend a little bit more time discussing that. I think that wasn't fully reflected in your suggestions. Then we have one on governance and institutional capacity, which was mentioned, and of course good governance is necessary to deliver no matter what program. And a lot of the more detailed aspects that were mentioned, such as timeliness of payments, they of course fall into the governance and institutional capacity criteria. The sixth one, financial and fiscal sustainability, was also mentioned. I mean, I think that's very intuitive. Of course, there need to be sufficient resources committed, and this in a sustainable manner, so also over the long term. And both at program level, it needs to be financially sustainable, but also at the central government budget level. Then coherence and integration, this was also mentioned. The combination of schemes and programs available need to be coherent, but also social protection policies need to be coherent with other policy areas. Responsiveness, the system needs to be flexible to respond to changes over time. Cost effectiveness, that was also mentioned. You need to ensure that you invest your limited resources to achieve maximized impact and incentive compatibility, and this is across all the stakeholders. So incentives need to be set right for potential beneficiaries, but also for the program administrators, for the tax collecting authorities, etc. Next slide, please.
Veronika?
Yeah?
I told you the problem with the background noise.
Sorry. Yeah, I'm afraid there's nothing I can do about it right now. Unless, I don't know.
Okay.
I can come a little bit closer to the microphone. So, coming to the first criteria of inclusiveness, as I said, this is aiming to have everyone protected. And I mean, noting that everyone protected doesn't mean everybody gets benefits, but there is a universal human right to social protection. So everyone needs to be adequately protected against life cycle risks. And the particular challenge here is to also reach the poorest and most vulnerable. And in order to ensure accessibility for the poorest and most vulnerable, it is important to keep in mind non-discrimination, gender equality, responsiveness to special needs, to ensure that programs really are effectively available to the entire population so that they can use them when in need. Next slide, please. Sorry. Adequacy. So this comes. This was also mentioned by you, and this is the second most important criterion. Are the benefits provided adequate to fulfill the social protection needs of the population? As a minimum, they should ensure income security and access to health and other needed services along the life cycle. And of course, they should achieve national or program objectives. And for this, it's important that the benefits are provided on a regular basis and predictable. And this is a great challenge in many countries that, for example, benefits that are set up to be paid every 2 months, beneficiaries don't effectively receive their benefit every 2 months, and then the program fails to reach objectives such as income smoothing. Next slide, please. Appropriateness. This refers to providing optimal protection of, regarding the social protection needs of the population, also in the long term, so over time, taking into account financial and institutional capacity. So the social protection programs need to be designed keeping in mind the resources available and the capacity to deliver them. And the design can only be appropriate if it is informed by evidence. And of course, this is one of the key objectives of CODI, to provide a sound evidence base on the situation in the country that then enables a tailor-fit design that meets that really is in line with the country situation and context. Next slide, please. In order to fulfill their function as providing adequate protection, it's really important that entitlements are anchored in law. There's a difference between charity that obviously is also important to help poor people, but this is different from giving people genuine entitlements to certain benefits. So it's not just the program that needs to be anchored in law, but the law needs to make very specific provisions regarding the range of benefits, their qualifying conditions, and the level that they will be provided at. So that, and this is another important aspect of respect for rights and dignity, so that people can initiate a complaint or make an appeal if they feel that their entitlement is not being given to them or not being granted. Of course, for this, a potential beneficiary needs to be well informed about what benefits they're entitled to. And other aspects that are relevant for respecting the rights and dignity of the population relate to a respect for human rights standards and principles, and in particular, private individual information. This protection of privacy is becoming increasingly important as there's more spread of electronic database management, and it's easier to get hold of sensitive information. It is becoming increasingly important to also make sure that there is security standards regarding database management, etc. Next slide, please. The fifth criterion regards governance and institutional capacity. I mean, a lot of us will already know the key principle for good governance, that you need to clearly specify roles and responsibilities of the actors involved. There need to be clear information channels and an opportunity for stakeholders to participate in the design, implementation, and monitoring of social protection programs. Then another key aspect, of course, is the sound financing. So in order to avoid any errors or fraud or mismanagement, the financial management needs to be accurate, reliable, accountable, and transparent. Sufficient institutional capacity has to be put in place, both regarding the number of staff and their qualification and skills, and a diversity of financing and delivery mechanisms needs to be considered. Next slide, please. I already briefly discussed financial and fiscal sustainability. So in terms of program financing, if programs are contribution-based, it's important that they take into account beneficiaries' capacity to contribute. And for those parts of the population that don't have any contributory capacity, obviously alternative financing mechanisms should be envisaged. then if there is external financial support, it's important, I mean, and this is often the case for starting up new programs. However, if there is external support, there should be a clear plan for how to phase out that external support. If a program is meant to be sustainable in the long run, it should be financed from endogenous sources. Can we go to the next slide, please? And this was another criterion that you correctly identified regarding the coherence and integration. So this is important both, as I already mentioned, external coherence. So there needs to be coherence between the social protection policies and other economic or sectoral policies, so that health, education, but also agricultural policies, etc., employment policies, and social protection policies go hand in hand, and complementarity is ensured between them. And internally within the social protection system, it's important that the different programs complement each other regarding the target groups that they aim to reach, or the objectives that they want to address, or the risks that they address. So that there's the whole system functions coherently and there's no duplication. And this also regards the delivery arrangements, so that there's no duplication in the design, administration and delivery of the programs. And this of course speaks to the challenges that I mentioned in the beginning regarding the fragmentation and lack of coordination. Next slide, please. Responsiveness refers to the flexibility of the social protection system. I mean, it would be nice if benefits could be designed once and for all, but as we all know, there is a dynamic political, economic, social, demographic situation, so things change constantly over time. In addition to these arguably slower changes or trends, there can also be shocks like natural disasters or climate change events that make it necessary for the social protection system to address additional risks or needs of the population. We can see that very well with pensions. Pensions are very long-term benefits, and it's sometimes very difficult to project needs of current contributors. When you start your contributing to a pension scheme that's contributory, you will receive benefits 20 or 30 years later, and there's a constant need for readjustment to make sure that pension systems are sustainable, but also for other benefits it's necessary to ensure flexibility and responsiveness to get the design right. And this, of course, requires a constant monitoring and evaluation of the developments to make sure the design fits the needs. Next slide, please. Cost effectiveness, this refers to using the minimum amount of resources required to achieve the maximum impact possible. So it's both an efficiency but also an effectiveness consideration, and get the right balance between the resources that you invest and the outcomes you achieve. Next slide, please. As I already said, incentive compatibility refers to getting the incentives right for across the board for the persons of working age to work, save, and to participate in risk pooling arrangements. The idea here is, of course, that contributory schemes are more or less self-financing. So anyone that can afford to contribute to social insurance arrangements is off the bill from tax-financed systems, potentially. But also the incentives need to be right for employers, so that that evasion is limited and employers actually register the workers and pay the required contributions. At the same time, the tax authorities need to do their job and collect the required contributions and taxes. The service providers need to enroll the eligible beneficiaries and provide the services. And beneficiaries need to have arrangements in place that actually make it easy for them to become a member and take up benefits. Next slide, please. So once we've collected the information across the 18 different key areas through the questionnaire, that information is then being used to fill out the assessment matrix. The assessment matrix is organized by assessment criteria, the assessment criteria that we've just discussed. And as you saw when I showed the example of the questionnaire, the last column had indicated which of the criteria are relevant, so that you can then quickly filter in the questionnaire those questions that speak to one criterion, and that can then help to complete the assessment matrix. And so, I mean, as you saw, the definition of each criterion is sometimes quite complex and speaks to different aspects. So in the assessment matrix, this is broken down into the different aspects, or if you want, indicators. For inclusiveness, for example, there is an assessment of the extent to which a social protection system addresses gender equality, non-discrimination, and special needs, or takes that into consideration. And then, of course, as we already said, arguably the most important aspect here is effective coverage. But I didn't put all of the indicators for inclusiveness. I just put effective coverage because effective coverage is very important, but there's also an indicator on scheme enrollment or on legal coverage. And then the final one is accessibility. So as we already saw, inclusiveness, getting people effectively protected, requires that programs and benefits are accessible. So this is just an example, but the assessment matrix does this for each of the criterion. And as you can see here, the evaluation is carried out on a 4-point scale. So it goes from a latent to an advanced stage, or a weaker to a stronger performance. And each of the cells, we've filled in some guidance of describing a situation where we think this can be classified more as latent, or this can be classified more as advanced, or somewhere in between. This is just a suggestion to give some direction of how to carry out the assessment or the scoring. I mean, it's not set in stone, and one feedback we had from one country application was that given the country context, not all of them are a good fit. So obviously it's very difficult to formulate a generic situation here that will be perfectly speaking to 190 countries. So arguably this also needs to be adapted to the country context. It's just to give some guidance. It's not, this is not set in stone. Next slide, please. Sorry, I'm aware that I'm talking quite long. I hope we can still move to a few questions and answers soon. So application of CODI, this is what we'll see in detail in the next seminar. Basically it goes from a planning and preparation stage, where the research team is identified, preferably through a combination of government or national staff, and if needed, inviting external experts from international organizations or academics into the process to support it. And this is really a key step, the pre-population of the questionnaire and adapting the questionnaire to the country context and to the specific needs that the government expresses. If there's a specific reform question, it may make a lot of sense to adapt the questionnaire to really address the key concern that the government has, to make it relevant for the country context. Then the data collection through the questionnaire, the assessment using the assessment matrix, and then the drafting of the country report. Next slide, please. Just a few points to keep in mind while carrying out the or while applying the ISPA tool. The aim is to just gather and collect the information that already exists at country level. There wouldn't be any new surveys carried out or new data, especially quantitative data collected in the context of an ISPA tool application. So that it doesn't replace in-depth research. It's meant to be a rapid diagnostic. Secondly, the findings are not comparable between countries. As I said, the tool will be, and this is related to the third point to keep in mind, the tool would be adapted to the country context before being applied. And most of the times, because of path dependency, social protection systems in each country are so idiosyncratic, you can't compare between countries. However, it can be used to track progress over time. So if a country decides to periodically go through an ISPA assessment using CODI of the social protection system, now and 5 years down the line, most likely the results will be comparable to track progress over time. Next slide, please. So we've already mentioned several times the upcoming seminars we have. So next week there is, on July 13th, a discussion of the experience of applying CODI in Belize. And as we already mentioned, we now have the French and Spanish versions of CODI available. So if you have any colleagues that would be interested to use the tool, I mean, this is now in English, the webinar, but we also have upcoming webinars in French, and the tools themselves are already translated, so they can be applied also in French and Spanish-speaking countries. Next slide, please. And sorry, I've taken up a lot of time, but I hope you still have some questions, and we can have a little bit of a discussion before we wrap up.
Very good, Veronika. Thank you so much for your presentation. And we have like a interesting number of questions. We can start with a general question of why monitoring and evaluation is not included in the program design module. Monitoring and evaluation could be included across modules. That's the first question. If you want, I can collect a number of questions. We can group them if you prefer.
Yeah.
There's also a question of, does the tool also look at social protection financing? And a third question, why so much emphasis in gender and social inclusion?
Okay, I'll go with these three first, and then we see. So yes, monitoring and evaluation, of course, you could also assess first the design of the monitoring and evaluation framework and then the implementation of it. I'm not sure whether that would not lead to a lot of duplication. I mean, it's arguably difficult to separate out the two, but in principle, it's right. It could make sense. We decided to only put it once, and we put it in the delivery. I think arguably it's different from looking at the benefit design, where really you need to make very conscious choices of the kind of benefit that you want to deliver. For example, for a child benefit, I mean, it can make a huge difference if you deliver a family allowance in cash, or if you decide it's a completely different thing to, for example, try and improve child nutrition by doing a school feeding program. Whereas the monitoring and evaluation framework, I mean, that you look at it, I mean, if you look at the design or the implementation, I'm not sure you would have so different aspects to discuss. Social protection financing, yes, it's discussed. There's a section on this at the policy or central module. So it looks at the government budget and the overall social protection expenditure and fiscal space and also sources of financing. And then it's discussed again at the program level. So there's the financial management for each individual program. And the questionnaire contains the related questions and the relevant modules. Then the question on emphasis on gender, because gender aspects and gender equality is a hugely important issue in social protection systems. Women and girls are immensely disadvantaged when it comes to social protection. This is often related to labor market structures and due to the fact that in many countries the large share of the care burden, both for any dependent family member, whether it's elderly or children, still lies upon the woman. And this often pushes women into informal work arrangements. And as a consequence, they are very often not included in formal social protection arrangements. And even for informal or non-contributory social protection arrangements, the design of the program really needs to pay specific attention to female everyday life arrangements in order to make benefits accessible for them. It's really important to look at time budgets and women's chores and livelihood strategies and analyze them to make sure that you find a benefit design that will be accessible for women. Otherwise, there's a great risk that women are not sufficiently covered through the social protection arrangements. And of course, gender equality is a key concern. It's one of the Sustainable Development Goals, and it's something that the international community committed themselves to achieving. And without paying particular attention to women's needs, it won't be possible to achieve equality in terms of social protection outcomes. I don't know, Luz, if, of course, feel free to jump in if there's anything that you want to add or clarify. Otherwise, we can do a next round of questions.
Yes, we have another question. Will the assessment look on the non-contributory, especially social protection for informal workers that cannot contribute? That's one question. If we want to do the assessment, are there any experts available to do it? And a third question that is related to that. What time is needed normally to run CODI? How many people?
Okay. So yes, the CODI framework is set up to analyze both contributory and non-contributory social protection programs. Therefore, also paying attention to reaching people in the informal economy. And this is, of course, included in the inclusiveness criterion. If you want everyone to be protected, this including the poorest and most vulnerable. Oftentimes, of course, the people that are poor and vulnerable are the ones in the informal economy. And yes, you need to pay special attention to that because, again, it's much more challenging to reach people in the informal economy with social protection programs. than the ones in the formal economy. Although, I mean, there's of course also evasion in the formal economy, but typically the percentage of the population not covered is larger in the informal economy. Experts, in principle, yes. I mean, first of all, it's good that you ask about experts, because as you may have noticed, this is not a layperson's tool, especially for the adaptation of the tool to the country context, but also for the data collection. I think it's indispensable that you have a minimum background of social protection in order to be meaningfully using the tool. Also, as you will have noticed with the criteria, there is a judgment call to be made. It's not so easy to carry out the assessment, and you need some social protection background and expertise in order to make this judgment call on the performance across the criteria. We have a small pool of experts that are already knowledgeable about ISPA tools and about CODI. We also offer tailor-made trainings. So if there is a country that wants to apply CODI, we would also train the national staff and assist them in doing this. However, we don't have the resources to pay for this. So the government would have to provide the financial means of carrying out this training, or the financial means to pay the experts to carry out the assessment. So ultimately, and I mean, we can also support fundraising for this and approach donors and see if the funds can be found from other sources, but we don't have any resources ourselves to do CODI assessments. But we are happy to support you with either identifying suitable experts or trying to find together sources of financing.
And Veronika, if you let me complement in that point,
yeah.
I think that it's from the ISPA coordination team, we also can offer you like help, virtual training or virtual technical assistance once you are in the process of collecting your information or organizing your focus groups, or if you are identifying who are the main stakeholders to conduct your assessment. We will be happy to guide you at any point, or also, as Veronika said, to put you in touch with people who are knowledgeable on your particular country and your particular context. As Veronika said, this is a new tool, and therefore there's still a lot to be learned on its implementation. I mean, this is a tool that it's dynamic and it's gonna change with the time, but the idea is to have like a larger number of applications so we can improve the tool and possibly make it more user-friendly and hopefully digitize it at some point.
Yes, so thanks, Luz. Of course, that's really important. We have an ISPA help desk. So if you're in the process of applying a tool and you're stuck, or you have a question, or there's something that you don't understand, dropping us a quick email or trying to contact us through the website we are always happy to help with that remotely. Now, the last question, that is very tricky, the time needed and how many people, because it's very country context specific. It depends on the complexity of the social protection system and programs in place, but also of the administrative levels. I mean, if you think of, if you wanted to do a social protection system assessment in India, all over India, where a lot of that is actually responsibility of local governments, it would be an enormous amount of work. Whereas if you went to a smaller country with a less complex administrative structure, it would be much easier to do this. And likewise, I mean, if you have very good national statistical offices that keep good records up to date regarding population and demographics, regarding poverty profiles, etc. And that information is readily available, as well as the social protection programs, and they keep good administrative records about coverage, membership, benefits delivery, etc. Then it's easier, whereas it's really complicated to dig out all this information, and there's no standardized data collection process, etc., etc. It will take much longer and also more resources to do it. Overall, I mean, I really hesitate to say something, but I would say that you should estimate at least 6 to 9 months in terms of time. And I think you need a core dedicated team of maybe 5, maximum 10 people carrying this out, or I mean 2 or 3 that are then really doing the data organization right up. But for the collection, it's probably good to have more than the core 2 or 3. And then it's good to have a larger, and this is all described in the implementation guidelines, and we will discuss this in detail during the next webinar. So apart from the core group of the assessment team that's actually doing the nitty-gritty detailed analysis, there should be a larger group of stakeholders that are being consulted with, that are providing information, and then there should be a higher level steering committee that really ensures that the assessment is addressing the key concerns relevant at the country and giving some high level directions to this. Do we have more questions, Luz?
Yes, we do. We have a question about is the typology of programs, social assistance, social insurance, labor market, aligned with classifications in Aspire? And I may respond that question if you like. Yes, it is aligned. As you know, CODI is an interagency tool, and therefore we are trying to be agency neutral. But we have taken a lot of elements from other work that has been done at the World Bank, ILO, and the other different organizations that belong to ISPA. So in this case, yes, it is aligned with the classifications in Aspire. We have one more.
Can I just add to that?
Sure. Yes.
Because I think, I mean, yes, it is aligned to that. However, I think it's good to note also that it's also aligned to the social protection functions or risk categories. So in the questionnaire, you will sometimes find questions that follow more the logic of a social assistance, social protection, labor market, as a social assistance, social insurance, labor market, and then other questions will break this down further, and will more ask for the typical 9 contingencies, so maternity, health, unemployment, old age, etc. So there's both the life cycle logic and the program typology logic reflected in the tool, and different parts of the questionnaire, depending on the context, what makes more sense, use either the one or the other.
Mm-hmm. Okay, another question. The tool seems too wide. For small and independent individuals who wish to implement and start a social protection program, where do we start? I think that is a great question.
Yeah, I mean, it's true. We talk about a rapid diagnostic, and then we come with a massive tool of 18 key areas, 10 criterias, and I don't know how many 100 questions. However, the tool is designed not to assess a program. It's designed to assess the entire social protection system. And it's by far the most complex tool among the ISPA suite. And yes, it is complex, but by organizing it according to these modules and key areas, it can be broken down into different parts. And so if you already have a key concern, for example, you really want to focus on the financial sustainability, or you really want to focus on administrative efficiency, You can, of course, then tailor the questionnaire by really going into much detail for the questions that address your area of concern, and then maybe throwing out some questions that, yes, they are good for an entire system assessment, but if you really want to focus on one aspect, maybe you can leave some out. Having said that, the countries where we applied the tool, when they first saw the tool, everybody said the same, wow, this is really too long. And then when we, after carrying out the assessment, when we asked, okay, it's too long, so I mean, what should we throw out? What can go? What is not so important? Very often we got the feedback, well, actually, these questions are all important, and they are all necessary to look at if you really want to look at the strengths and weaknesses of your system and know how to improve the weaknesses. You need all this information. And actually, often we even got suggestions for, here we would even add a few more questions because here we think this and this would even be useful to also look into. So it's a challenge to do this correct and meaningfully and still keep it simple, and it's difficult to strike the balance there. If I understood the question correctly, the question was how to start a new program?
Where do they start? The question is, the program seems too wide. I believe that they mean the tool. For small and independent individuals who wish to implement and start social protection programs, where do we start?
I mean, difficult question. I think I would start with a social protection needs assessment. That is really looking into socio-demographic characteristics of the population, and on that basis trying to identify what is really the greatest need. I mean, look at standard health indicator outcomes like child nutrition, child mortality, general poverty rates, broken down by, if available, geographic areas, etc. And then, arguably, if you find a pattern on the most urgent social protection needs, build your program around that. But I mean, I think it is important to collect a minimum amount of data and evidence before starting any program. Otherwise, it risks to create overlaps and duplication and inefficiency. And it is really important to invest a lot in that question. What is the real most urgent need, and what is the most adequate design to address this need? If you don't get that right, then the program at best wastes precious resources, and at worst can even have damaging unintended consequences. So it is important to carry out a sound analysis first, I think.
Good. We have a final question. I mean, we are reaching, we still have some more time. How important is to gather information from the non-governmental sector and public sector? From the non-governmental sector, I believe. There are examples of social protection funding through private sectors using corporate social responsibility. And I think that, I mean, in that case, I think that if you have a country that is heavily funded by an NGO or by private funding, it's important to document that and to definitely collect information and do the analysis as you will do for any public or government funded program. Depending on the on the scale of the program and on the relevance in the particular context, that's like a judgment call. I mean, you will have to document it, in my opinion. I mean, we have that experience in some African countries, and they do collect that information. So this is not meant to assess only government funded programs. Veronika.
Yeah, no, I fully agree. I mean, it's the idea is to capture all the benefits that are being provided, whether they're offered through public institutions or NGOs or private entities. So in the mapping or the stock taking, all this information should be captured. However, the emphasis of the tool is more on the public schemes and programs, because international standards say that, and this speaks to the rights and dignity criterion in a way. Internationally there is an agreement, it is agreed that the only actor that currently can reliably provide social protection for the population is still considered the state or the government, and so that there is a focus on legally anchored schemes and programs. But obviously, in order to rightly identify social protection needs of the population, if, for example, a lot of companies already offer occupational pension schemes, then that section of the population already is covered for the old age risk through the occupational schemes to a certain extent. And so the priority need would then more be cover those workers in the informal economy that don't have access to any pension scheme, not the public one, not the public contributory one, and not the occupational ones. And so obviously, in order to identify needs, you need to be aware of any social protection program, no matter who provides those benefits.
Mm-hmm. One more question. Can you tell us more about the training that you offer? Is it in person, in country, or webinar? What kind of resources are needed? So if you want remote training, what we can offer is to do like an audio or video conference to discuss your particular case, to understand what sort of analysis you are doing, and to guide you on what are the first steps that you have to work on. That will require only like a WebEx. I mean, we can do a WebEx audio or video conference, or I mean, depending on what technical resources you have. I mean, this is the basic that we can offer. We also do in-country face-to-face training, but as Veronika said, we have very limited resources, so it will have to be funded by the government, and it will be like a hands-on session on how to do the assessment, and it will be mainly targeted to train the people that will conduct the assessment. That's basically, also we are preparing a series of face-to-face learning events, but more like on a regional base. And we can anticipate that we will have one targeted to East Asia in early 2018. But we are in the process also of thinking of additional training sessions for regions. But this is, I mean, we don't have the schedule and the agenda of those sessions yet. So in the immediate term, what we can offer is what I mentioned, an audio or video conference where we can start talking about your particular request and your particular assessment or diagnostic.
And potentially a request for a face-to-face learning event if the resources are available.
Exactly. Okay. We have more questions coming on. Okay, we have several questions from our friends in Nepal, and we are happy to have a conversation offline because there are a lot of very detailed questions on monitoring and evaluation. For example, they have another question on respect for rights and dignity. How can we link individuals to different programs in terms of delivering the life cycle coverage? If we talk about the privacy, then we will have A, a problem of linking with other programs, and B, issue of transparency? Please guide me.
Yeah, very good question. There is, of course, a trade-off. I mean, if you want to increase administrative efficiency by, for example, providing different benefits through one administrative entity, inevitably there will be a lot of data accumulated at that point. So potentially jeopardizing the privacy, but increasing the decreasing the administrative cost. So, but I mean, there are very clear standards on how this can be done, potentially minimizing the data that is being transferred, and there are very clear standards on this. By first of all, only collecting the data that is absolutely necessary to run the program. So I mean, if you register people on a program, they shouldn't be required to fill in as many questions on all their personal details as you can think of, but really think carefully, what is the information that you already need to reach the program objective, and then only collect that data. And then within the administration of the different programs or benefits, think about how can you anonymize the data. For certain processes, it's not important to have the complete data set, but you can allocate numbers and then only and don't have the names or places attached to it, and for certain administrative steps, that's absolutely sufficient to carry out what you need to be doing. So I mean, this is very detailed, but there are strategies that can try to ensure to the maximum possible confidentiality of private information, but still trying to consolidate certain administrative steps and thereby making the administration more efficient by doing certain things jointly across programs. But I mean, this really goes into a lot of detail, and I think we would have to do another webinar on management information systems or record keeping and membership management and privacy of information to really address all the details of that. And it is very highly technical, but yeah, just to mention that there are clear standards and strategies of how to maximize confidentiality of the information and administrative efficiency to the extent possible.
Okay, we have one final question that is not related to CODI. It's more about the Public Works program tool. It says, I'm particularly interested in Public Works and downloaded the matrix and questionnaires from ispatools.org. My question is, how do we consolidate and detail the details generated from the questionnaires? And is there any specific ways to report? Yes, we have in the same website, we have what we call the country report outline that offers you like a guide of what are the main elements that you should include in your report. We do have one report to share, that is the recently application of the Public Works tool in Tanzania. We can share it with you. And basically what it does is to provide like a general background of how the country is and what the particular Public Works program being assessed, what are the characteristics, and then it goes module by module explaining how the program is performing. And the Public Works tool has 8 different modules, so it goes module by module, responding also to the questions that were addressed in the questionnaire. So we will be happy to share those that report with you. And I encourage all of our participants today, and especially our friends from Nepal that have been very active with their questions, to get in touch with us. Maybe we can organize a special session conversation to discuss all your questions and your reflections, because you also have some suggestions on how to improve the tools, which are fantastic, and we are very happy to receive those as well.
Yes, please do contact us. The slide is now up with the email addresses in the bottom. So please send us an email, and we will be happy to follow up. And if you're interested, we could do a kind of private session and address your more specific concerns and questions.
Exactly. So thank you everyone for your participation today. We had around 35 participants today. Thank you to Veronika and to the whole audience. Thanks to the socialprotection.org team, always very, very generous with us. And please join us next week for our new webinar and on the application of this tool in Belize. We are hoping that we can share at least executive summary before the actual webinar for your information. And remember, in September we have the webinars in French. Thank you so much.
Also from my side, thanks a lot to everyone for your interest and listening in.
Bye-bye.